Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Okay, Nina, tell me what's going on with your foot. What happened?
Well, for about a year it hurts really bad on the bottom and it's just, it's horrible, horrible.
How did you hurt yourself?
I'm not sure.
Okay. So for a year, where do you feel the pain and what kind of symptoms do you have?
The heel mostly.
You feel pain in your heel?
Yeah.
Can I see it where?
Yeah, it's like right kind of in here somewhere.
Okay, in here.
Yeah.
How much pain from 0 to 10 and what aggravated?
Walking, housework,
Okay.
going to the grocery store. If you're on your feet too long,
Okay.
you're going to pay for it that night. Let me tell you, you're going to pay for it.
So for a year, what kind of treatment did you have that year?
I didn't do, I iced it. Lately, if it gets really bad, I'll take a Tylenol.
Did you have like a chiropractor, acupuncture, massage?
Oh, I did. I just had chiropractic and he did the activator on it.
Okay, so,
Didn't really work.
okay.
I've had acupuncture.
So acupuncture,
4 days, felt
okay.
great, comes right back.
Okay, temporary.
No matter what I've done, the stretching and
So, what kind of symptoms do you have? Do you feel like more pain in the morning when you wake up and taking the few steps and start to loosen up?
yes, when you first get up or if you get up in the middle of the night,
You feel like
your
sharp
tippy toe, you
stabbing
can't walk on your foot.
On your foot, okay.
It's like that's the worst.
Stabbing pain, or you walking on the glass or
Yeah, like a
something.
knife going in and out of your foot.
Yeah. And do you feel the same thing when you rest for a while and you start to take a few steps?
Yes, exactly.
So that's a classic plantar fasciitis pain. Okay, so I want you to walk and try to put weight on it.
Okay.
So we want to try to stimulate the pain now to see how you respond to the treatment.
Okay.
So we'll have you walk in the
Okay.
way. And you tell me how much pain, okay?
Okay.
How much pain?
Getting pretty bad. It's probably getting up to a 7.
7.
At the end of the day, it'll go way up.
Okay, so now it's 7. We're going to walk back and forth a couple of times.
Okay.
So you're kind of dragging your foot, you're limping a little bit, and actually your weight more on the right side.
Maybe, yeah.
So you're putting more weight on the right side.
Okay, I'll try to
because-
put a lot of weight on it.
Because it's painful to put weight. Yeah, try to
Yeah,
put.
and then I'm going to pay for it later. you
Well,
know,
we're gonna
like-
treat it now.
Yeah,
Okay.
okay.
But let me know how much pain.
I'm going to say, because I've been off of it today, and it's early in the day, it's about a 6.
Okay.
But it can get to 8 or 9, where I
Okay,
can
and
hardly
alright,
walk.
Okay.
Yeah.
Are you comfortable lying on the stomach?
Yeah.
Okay. So we'll have you lie, so it's the left foot. Yeah. Lie on the stomach.
Okay.
Over there. You take this phone.
Okay, want me to go
Put your
here?
head over there. Okay. Okay. Bend your knees, both of them, and relax. Okay. Make sure everything is pain-free, okay?
Okay.
So it's your left, right in here, yeah? Is that
Yeah.
painful?
Kind of, yeah, in one spot it's real painful.
Oh,
Probably a
wow.
little lower,
In here?
more to the edge, probably.
In here?
Kind of radiating over here these days too.
In here? Is that painful?
Maybe right. You're not on it yet. Let's see.
In here.
No, on the bottom, but more toward the heel, I think.
Okay. Right, around this area.
Yeah.
Is that painful what I'm doing?
Actually, keep doing it.
Okay.
You haven't hit that really bad spot.
Okay.
Yeah.
Here?
You're on it. Yep.
Here?
Yep.
Okay. Is that painful?
Yes.
Don't kick me, okay?
Okay.
Alright. Make sure what I'm doing is not aggravate your symptoms. How's this?
It feels okay.
Okay. So this is a spot that you feel it's stabbing when you put
Yes.
it on. You feel pain here?
No.
Okay.
Yeah, you're on it.
How is that?
I can take it, yeah.
Make sure it's not painful.
No, it's not.
Okay.
I mean, it's, a dull ache, but if it's good for me, I can take it.
No, if you have inflammation, we don't want to aggravate
Oh,
it.
okay.
You know what I mean? If you have an open wound, you don't want to rub it.
Okay.
Okay? It's okay to feel pressure. It's not okay to feel pain.
Okay.
If you feel pressure, that's fine. That's the treatment.
Okay.
But if you start to feel pain, just let me know and I'll take it easy because I don't want to cause inflammation. I disagree with the philosophy no pain, no gain, because if you have a micro tear and you will keep aggravated, that's going to be a major tear.
Okay.
So we want to make sure the treatment is not painful. So I'm not actually going to work on the inflammation now. I will
Okay.
work on the proliferation, release your scar tissue, the fascial restriction, and all the tightness, and see how you respond.
Okay.
If you feel better, you're purely stuck in the proliferation stage.
Okay.
If you're still feeling pain, that's an indication you might have some localized inflammation, and I will jump and work on the inflammation protocol.
Okay.
So I'm not going to use the Magna Heal initially. I will use it at the end if you have inflammation. Do you have any seizures or pacemaker or anything like that?
No.
Okay. How does it feel?
It feels okay. It
Okay.
doesn't hurt. Yeah.
Mm-hmm. Yeah, it feels warmer than this side. Oh, that's cold. This one. Can you tell the difference?
Interesting. Yeah.
Mm-hmm. Can you feel it or no?
Yeah, I can.
Okay. Yeah, I can feel it like it's warm here. Okay. So you feel this knot here? This one.
Yeah.
Is it too much?
No, it's not.
Relax. Do you want to feel scar tissue?
No.
No? Okay. Some family members like to feel it with the tools.
Yeah.
Use it just to get the
I
feel
find
of
it
it.
very interesting though.
Okay. Yeah, it's very easy with the A3 and A4 tools to really feel the scar tissue. You will be able to see it actually when I do. When I use the tool, you're going to see the map of the scar tissue with the redness where she has more scar tissue. And you will see it with the tool just going over the scar tissue. I'm trying to do deep release now. Is that too much?
No, it's okay. Very tender. Yeah,
Sorry.
you got it. Yep.
Make sure it's not painful. I don't want you to feel sore from what I'm doing, okay?
Okay.
Do you usually drink water?
A lot of water.
I see a little scar here. What's going on here?
Neuroma. That's
Neuroma?
where I had the neuroma surgery. Yeah.
Okay.
Yeah, I drink a ton of water.
Okay, that's good.
I don't drink soda.
That's good.
Nothing but water. I'll have some coffee. And no milk, just almond milk.
Oh.
Not very often though.
We'll talk about that.
Maybe once a month.
Okay.
No cow milk.
Really?
No way.
Okay, we'll go over the diet after
Okay.
this. Yeah, I'll be careful with almond milk or any artificial milk. We'll go
Oh.
over why after
Okay.
this video. Yeah, when I do the nutrition analysis with you. If you make it at home, yes.
Oh, okay. You
The
squeeze
one
it
in
out
the
of there.
stores, they put a lot of junk in it.
Okay.
That's, if you make it at home, you can, that's fine.
Okay.
They have to put preservative and other stuff that's
Ugh.
not the
No
best.
wonder it lasts so long.
Yeah, guess what?
Ugh.
Why it lasts forever?
You think you're doing something healthy?
If something doesn't expire or
You're
take
right.
forever,
For 3 months, yeah. I guess
Yeah.
I should have figured that out.
you know, you after harvesting, like they did a study and they found 3 days later you're losing on average 30% of the nutrition of the fruit and vegetables. So if they harvest the fruit and vegetables and it's like 2 weeks, you're probably very good, like 70 to 90% of the nutrition
Oh my
value
goodness.
lost. So what do you expect?
So I'm juicing and I'm probably not getting the benefit I should be.
Well, if you juice and drink it quickly.
Yeah, I do
yes.
it really quick.
I
yeah.
am not really crazy about juicing. I prefer blending.
Yeah, I do that too. I do both.
I will not do the juice because you know you're gonna lose a lot of nutrients.
True.
So if you want blend, not
Bullet,
juice,
yeah, the bullet.
you're gonna use.
I think celery. I put a lot of celery through that juicer.
Yeah, I will eat it better.
Yeah,
Or
you're right.
like, just blend it and drink it immediately. Do not leave it. Just fresh.
Yeah.
So this way, you're not losing a lot of nutrition value. Guess what? The juice that you have it in the market. So if when you cut the fruit, that's you start to lose a lot of nutrients if you
Yeah.
don't eat it quickly. So juice in the
Neutral.
bottle that's been in the store for 2-3 months.
Interest-
What kind of nutrition you have there?
Oh my! I didn't even think about that.
I'm not sure about how much nutrition will be there.
Wow.
You know, because it's a process. It's better to eat fresh, make your own smoothie,
Yeah.
and drink it
You're
fresh.
right.
Okay. You see the scar tissue here? See that redness?
Yes.
That's here, and there's a knot here.
Oh.
Look. Stuck. You feel that?
Yes.
There
Oh,
you go. So is that painful? It's okay.
a little, but I,
Sorry.
you know. Yeah, it's okay.
Sorry.
It's okay though.
You see, like it's very thick. That's actually blocking the tool. I have to really decrease the pressure to.
There's scar tissue right there?
Yeah. Did you see how she limping? She compensating. So it started with the plantar fasciitis, but you start to have issue and scar tissue everywhere because you put more weight on one side than the
Yes.
other side. You know.
Man.
So you see, yeah. And we did not get to that. And here, she gonna actually feel on the plantar part, like going over grain, like sand, going over like rocks.
Really?
Yeah, that's usually the plantar fasciitis. I feel it here. Did you feel that?
Yes.
Yeah, if you want to feel it, that's your chance. There you go. You hear that sound?
Yeah.
Yes.
That's the scar tissue. It's like a sand or grinding here.
Wow.
That's amazing.
Yeah, you hear that, yeah?
Yes.
You feel it? Is that
Yes,
painful or
I
it's
do.
okay?
No, it's okay.
Okay. You can get this shot like closer, like by your ankle. I mean, like,
Yeah, it's like a rope, you know?
yep, you feel that?
Yeah.
And that's very typical for plantar fasciitis because the plantar fascia attached from here to here. So when you have like micro tear and scar tissue, instead of you have some elasticity in the fascia layer, that elasticity start to lose. You start to lose some elasticity, and it's you start to have adhesion. So things will be stuck together.
Oh.
So when you put weight, the first few steps, very stiff because things are stuck together.
Yes.
Walking a little bit on it, you start to loosen up a little bit. And I had plantar fasciitis that severe cases that's actually, you know how bad is your case. In the morning, how long it gonna take to loosen up. Some
Okay.
patient, they used to say like it take half an hour.
Really?
It take how long in the morning it takes you to loosen up?
I'll have to think about that.
Because that shows how bad is the inflammation too.
Yeah, I'm gonna have to think.
You know, and how bad is the tightness. But
Yeah.
you see here, like it's kind of vibrating. I feel vibration here with the tool. I can hear the sound. But that's gonna pull on her bone here, and her pain here compensation for the tightness in here. And she could inflame this area because she's shifting that bone forward. Even though you had chiropractors to correct it, but that's not gonna release it.
Mm-hmm.
we have to release this so things will be in a normal.
Yeah, the chiropractic,
Position.
it didn't help.
Yeah.
I went for my back and
It will help if they use ASTR's like tools
Yeah.
using soft tissue to release the soft tissue. But
well, I
if
told
you're
him
doing
about
just
it.
mobilization, that's not long term based on at least 6 to 7 systematic reviews.
He just used the activator on it,
Yeah.
and it didn't really do anything.
Will this come back?
The scar tissue, when it dissolves, it's dissolve. I'm gonna go over ergonomic, proper body mechanic, the right shoes to wear. If you do not do the things that cause scar tissue, it should not come back. You eliminate the trigger. But if she goes back and wear bad shoes
Or barefoot.
or
Barefoot?
barefoot, whatever, is some barefoot is fine, but if you never been barefoot for 50 years or 30 years, I don't think it's a good idea to start that late.
She probably was barefoot
You know
when she
what I
was
mean?
younger.
I've always
And
been.
then
You
she
know?
makes fun of me for not going barefoot.
I think it's on the beach is fine,
Beach, yeah, but I don't.
But if you start to have an issue, we need to figure out why.
Yeah, you're
You know?
right.
Yeah, but the answer to your question, if we eliminate the trigger, we know what causes scar tissue, and I will go over the whole list what causes scar tissue, so you know what not to do, so you don't have this issue in the future.
Yeah.
If you're compliant and follow the whole program,
Yeah.
and I had plantar fasciitis, I worked on it one time,
Oh wow.
but I knew the program. I
Yeah.
knew what type of shoes I wear,
Yeah.
So there's a lot of education after the videos just to make sure you're not going back to do the bad habits. And that's usually because it's a biopsychosocial model, it's a lot of behavioral modification. It's not just the manual stuff here. And based on a study, when we implement the biopsychosocial model, that you can get long-term pain reduction. We cannot just do the nice stuff, working on the feet or the hand or the body part, and then not doing the right thing at home. Does that make sense?
Yeah, because it'll come back, won't it? Because you're doing exactly what caused it in the first place.
How does that feel?
Feels
Are you going to be able to join the track team?
Well, I think we'll see how she's doing today. I had a patient actually was like in a few days they were going back to sports. It depends if she does not have inflammation, but I'm gonna go over what shoes she wears.
Yes.
If you wear the right shoes, and we're gonna try stuff here. We're gonna test several things here to make sure she's ready. So if she has a flare-up, I prefer to see her when she has a flare-up here so we can treat it.
Yes.
And I will go over the proper way of walking, because I will teach you how to walk again without limping. But I cannot do that if I don't release this. So we'll get you some water. And so I worked on a proliferation now, okay? So we'll have you drink some water and sit up for me.
okay.
And then we'll have you walk after that.
Okay.
So you felt all the scar tissue there?
Yeah, that was interesting.
Mm-hmm.
Very interesting on the heel.
Yep.
It felt like a rope, like
Yep,
rope.
yep.
Yeah,
So when you have a rope like that, that's mean it's tight.
that makes sense.
So it's pulled on your heel. You feel better after
Thank you.
walking a little bit, because you start to have that rope is warming up, so you will have more room to do heel strike. How's that feel?
I'm not sure. You
Let's
want me to
walk.
walk? Okay.
Yep. You're gonna walk back and forth and tell me how that feels. How's that?
I feel like more planted and better. Like it does
You put
feel.
more weight on it.
Yeah.
You're able now.
Yes.
You're not as shifting as before.
Yeah.
Did your pain gone, or you still feel it?
I still feel it.
How much from 0 to 10?
Probably like maybe a 4 now. It's went down a couple notches.
And you feel it in the same spot?
Yep. Here and then a little bit there.
Okay.
Yeah, and back here. You're right.
Okay. Let me do one more thing, okay?
Okay.
Okay, we'll have you lying on your stomach. So going down a little bit. Okay. Bend your knees. You said where do you feel it? In here?
Yeah, kind of at the edge.
Okay. I'm gonna do one more thing just to see if it's. I will still continue on the proliferation.
Okay.
And if this did not work, we'll jump to the inflammation. Working
Okay.
using the Magna Heal, okay?
Okay.
So let me try this first. Is that too much here?
No.
And here, okay?
Okay.
And tell me, any difference after the second time or the same?
No, more relief.
More relief?
Yeah, it feels
0
more
to
like
10?
a tube.
So went down to 2.
Yeah.
So, okay. So I'm gonna work on inflammation now. I'll use the Magna Heal. If it's mild, you know, it should take a few minutes to get it down to 0. If it's a little bit more than mild, we probably need to use it a little bit longer.
Okay.
We have it by your stomach.
Oops, sorry.
It's okay. Here you go. So it's right in here. It's right in this area.
Yeah, kind of more on the edge, actually.
Mhm.
I think here.
Here?
Kind of right. I think the worst of it is right, kind of there,
Okay. You feel it deep or superficial?
deep.
Okay. Well, the good news, I'm using 2 magnets here. So the 2 magnet, when we measure it, each magnet is like penetrate around 2 inches to 2.5. So collectively, both of them, we can go 5 inches deep in the body.
Wow.
And I'll show you when you set up how strong this magnet is. This is not like your refrigerator magnet. So, and I coat it with anti-inflammatory coating, so this way we can be a little bit aggressive to decrease the inflammation. How's that?
A lot better.
0 to 10?
It's still a little sore down there, but I feel like I'm planted equally, and
Equally.
I can put the weight
You're
on
walking
it.
faster, see
Yeah,
that?
yeah, you're
she's,
walking
she's
with
walking
me.
on the way.
Yeah,
a
it
lot
feels a
faster.
lot better.
Is it gone or you still feel it?
I still feel it
How much from 0 to 10 and where? The exact spot.
right here.
Okay, it's laying your stomach
Yeah.
again.
You told me not to kick you. I did.
That's sad. I'm just joking.
Yeah, no, I felt it when I sat up there too. I kind of stretched it.
Yeah. So it's
kind
right.
of going, radiating around.
Oh, this side too?
Yeah.
Okay.
It's a tough one.
Well, it's a little bit inflammation, so
Okay.
we'll see if it's not severe. We can get rid of it now. Just using this for a few minutes. For severe inflammation, I usually recommend that patient buy the Magna Heal and just wear it at night. You know,
Uh-huh.
put it in the sock in your
Oh,
sock, and
wow.
so this way you will work on inflammation for a longer time. That's usually for moderate and severe inflammation. Might take a few days or a few weeks, depending on severity of the inflammation. But at the same time, I usually like to do nutrition analysis to make sure there is no deficiency. Because when you have vitamins or mineral deficiency, your body gonna heal very slowly.
Okay.
So that's why
That makes sense, yeah.
that's why I look at your blood work and make sure everything is normal. How's that?
Pretty darn good.
You see,
Pretty darn good.
she's putting weight on it.
Yeah, weight.
Wow. Like, oh my, it's been a year since I could walk like this.
Wow, look at this.
I mean, I still feel kind of in the area, but nothing bad.
Mm-hmm.
You know, and I'm sure it's just gonna,
You have a little bit inflammation,
Wow.
so we gotta work a little bit more on inflammation.
Yeah, my foot even looks a little swollen, but from-
Yeah. So I had some patient actually, I told them to wear it at night, the Magna Heel. One patient just gave us a call the next day and said, visually the swelling in the ankle was gone the next morning.
Hey,
Yeah.
Yeah, it still feels kind of weird
see,
down
you
there.
can
But
see the swelling. Let's
Yeah.
roll the other leg up. You see the
Yeah.
difference? That's swell.
You're
You see
right,
the
you're
swelling?
right.
So we actually need to be a little bit aggressive with the inflammation. Might be like I don't expect like it's gonna be 100% back to normal. You probably how much soreness you feel now?
It's hard. It's kind of almost like you got you got hit and you got a bruise,
It's
but and then you feel like it's gonna gradually get better. That's kind of what I was
Yes.
feeling.
so technically because you visually can see the swelling,
Yeah.
we need to be a little bit aggressive. You can visually see. Look, my hand here. I'm holding here.
Yeah,
Look here.
you're
Yes.
right.
You see, so visually
Yeah, I
you
can
can
see
see
it.
the swelling. So if she does not have that swelling, I expect it's like 100%
Yeah.
back to normal today, because if it's purely in the proliferation stage. But because there is a swelling, I will give you some stuff after the video to get this
Okay.
under control, so we get that swelling down. You
Okay.
can see it actually here. Jim.
Yeah.
Look
Yeah.
here.
Oh.
Bring both of them here. Look at this area here and here.
Yep, you're right.
And in this area here. So
Yeah,
we're gonna
you're
work
right.
on that swelling. So what do you think about ASTR treatment? You had chiropractor, acupuncture,
I
and you had it
mean,
for a year.
I was impressed with the YouTube on that.
Where you come from?
Arizona.
Oh, welcome.
And it was worth it already just to be able to walk like that and have hope that I can start hiking and walking, and that's huge.
See, she's putting even weight now.
Yeah.
She's
You don't
sending them
you don't
both
miss
of
your
them.
feet till
Yeah.
you don't have them.
The
And
last
then-
2 times she's walked down there, she just.
Yeah,
Let's
I'm not
walk one
afraid. It's like I'm
But
not afraid.
before you could tell she was favoring it.
She
Look
was
at her.
favoring and she was slow. She was walking slow.
She'll never win the 100-yard dash.
Yeah,
but
it's weird. I just feel like confident to put my weight on it
Yeah.
now. I'm not afraid.
I can see it.
So, I mean, it still feels kind of weird down there, but I'm sure it's
The
going to get
swelling.
better. Yeah,
You
I have
need to
a,
get that down.
yeah,
Mhm.
yeah.
Yeah, that's
And it's
nice.
been there a long time, so it
Yeah.
can take a few days probably or something to.
Well, I gotta give you some stuff to speed up decrease the swelling quickly.
Yeah, great. I can feel the difference.
Awesome.
Yeah, I'm
Good,
sold.
good.
I'm sold.
Awesome. Thank you so much.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon.